So, Corey, can you give us a little brief summary about what role did this technique play in acupuncture's development?
Yeah, so Funso or division needling expanded on this prior concept of the five body constituents, being the skin, the vessels, the flesh, the sinews, and the bone. So it expanded on this by adding this extra dimension of empty spaces around these structures. So kind of as we just talked about, division needling targeted the empty space from below the skin to above the muscle, the empty spaces between two muscles, and that kind of thing. So it expanded upon that previously existing model, and actually you see, for instance, in the Neijing, when one is going to treat the sinews or the flesh, they actually specifically say to treat the funrogerugian or the divisions of the flesh, so as to treat them. So they kind of start to take the place of treatment for some of these tissue layers. Beyond that, so acupuncture kind of moves from a blood-oriented model to
Hmm.
a chi-oriented focus, I should say, from a blood-oriented focus to a chi-oriented focus. And simply what that means is that originally there was a big focus on examining kind of the color and shape of superficial vessels at the surface and directly treating them through bleeding, where division needling kind of comes in. It starts to shift the focus towards defense chi and treatment surrounding that. And it shifts the treatment towards the pulsating vessels at the body's surface and the regulation of the kind of pulse qualities in those vessels. And instead of treating them directly, it treats the space outside of the vessels. Funsa, it influences not only how like channel theory is utilized through the treatment of these pulse sites, but it influences an entirely new category of points called the chi cavities. It influences a development of points called the mu points that we're all familiar with. So it really just shapes kind of the whole developmental process of acupuncture.
Great, thank you.